Hi, Sam. My name is Kelly. I am one of your classmates for pharmacology. I just want to start off by saying that you did a fabulous job with your presentation. I think you spoke clearly and professionally. I love that you had a patient at the bedside in a healthcare setting. You had the patient on the exam table. It gave such a complete vibe or environment to have viewers see and grasp what it truly is like to perform a neuro assessment for patients in a healthcare setting. Um, it was very professional. You represented the video in a patient setting that gives a great representation. Um, I appreciated you breaking down each cranial nerve and demoing the assessment for each. You provided great examples for each cranial nerve breakdown. I love that you had even the little test tubes with the sense inside for the patient um, to grasp or state what scent is in each. I love that you provided the Snellen test on the presentation. And, overall, I just think it was very well done with the assessments. I couldn't think of any other type of changes in regards to that. I think it would be important, though, to include in the video patients that would fit the criteria of a neuroassessment being indicated. A question I'd ask if all patients in a particular healthcare setting would require these neuroassessment checks, and what is the patient's chief complaint that would indicate for the healthcare provider to carry out a neuroassessment. So to elaborate, I actually found a resource through Johns Hopkins Medicine in regards to neurological exams. And in the article, one of the tabs is why is a neurological exam done? It goes into saying that a complete neurological exam may be done in situations such as a routine physical, following any type of trauma, following the progression of a disease, and of course, if a chief complaint for a patient is any of the following, which is headaches, blurry vision, changes in any behavior, are they coming across angry more than usual? Is their effect different than even the last physical they attended with the physician or healthcare provider the year prior? Fatigue, changes in balance or coordination, numbness or tingling in the arms or legs, decreased movement in the arms or legs, injury to the head, neck, or back, fever, seizures. Seizures, I think, is very crucial. Seizures, you really want to see if how the brain is understanding, certain tasks. Slurred speech, weakness, and tremors. So, of course, stroke-like symptoms that present maybe in the ER or the physician's office. You want to do a thorough neuro exam. Other than that, I think you did a very good job. I think it would be important to include health promotions for patients with neuro issues. Will they need rehab, physical therapy, any type of resources, speech therapy to help them for if they do present with differences neurologically. I think that would be crucial to have a plan in place for these patients after assessment in the healthcare setting. And like I said, other than that, you did honestly such an amazing job. Overall, you really were concise and informative and thorough. I think you provided a great tool for people to learn and grasp how to carry out each cranial nerve assessment. So good job. Thank you.